an eye on the time. I just put my phone. Thank you. All right. So reproductive justice and oppression. This is on the tip of most people's tongue right now. This is coming up a lot. It's been a very hot button issue. And it is something that I honestly don't think it's never been an issue since I can remember. Like, it's always a question. It's always been controversial, I'll say. So some facts. 1 in 3 women will have an abortion by age 45. That's a significant amount of folks. For those who had an abortion, 75% said they could not afford a child. 61% already had a child. 42% live below the poverty line. Abortion patients by race, 36% are white, 30% are Black, 25% Hispanic, and 9% other. And those do not represent, it's in the references, there's a website. Yeah. And that does not represent what the population percentages actually are, right? So folks of color are overrepresented in these, especially Black and Hispanic folks, or Latinx folks, I would rather say, yeah. Women denied an abortion, 3 times more likely to fall below poverty within 2 years than women who had access. So it impacts that in a great way. The states where legal abortions are the hardest to get, if you look at this first map on the left-hand side with the blue on it, states with the most restrictive abortion access laws as of 2016, data compiled and analyzed by the National Institute for Reproductive Health, in case you were wondering. So these are the most restrictive states, and it's also where women are the most likely to live in poverty. Not a coincidence. Reproductive justice is not just a race issue, an individual issue, a body autonomy issue. It's also a class issue, which I think often is really skirted in the discussion. So if you look over to the right in that light green there, this is the states with the highest percentage of women living in poverty. This is from 2014, and the rates are above 16%. The most restrictive states also have an X in them. So they're green and with an X. And you can see that it is clumped in a certain area, right? And also where the most, I'm going to say Black women live, because African American does not actually include all Black folks. Not all Black folks are of African descent. Not all Black folks are American either, right? States with the highest percentage of Black folks the rates are above 10.7% in the blue states, and the most restrictive states, yet again with the X's there. Lots of overlap to that. So, sexual exploitation, violence, and forced reproduction were a central part of the slave trade after Congress passed the act prohibiting importation of slaves in 1807. Without the ability to import slaves from Africa and the Caribbean, slaveholders focused additional resources on ensuring their female slaves became pregnant and gave birth to healthy children to create future slaves and expand property, not poverty. Slaveholders used rape as a tool for procreation as well as a weapon to punish female slaves or for sexual gratification. Slavery is terrible for men, but is more terrible for women, said Harriet Jacobs on an escaped slave and writer quoted in Dr. Dorothy Roberts' book, Killing the Black Body. I recently saw a meme showing that in the feed for alligators, they were finding back in the day Black baby body, like body parts. And so I think when we actually take a step back and think about reproductive justice, we have to ask ourselves 2 questions. 1, what is it really about? And 2, who benefits? As a feminist, that question to me is always relevant. Who benefits from this? Who benefits from me not having body autonomy? because the folks who need it, who have access and resources, will always get it, no matter what. And I think that when we really look at this, it's more than it just being about controlling someone's body or about religion. It is really about showing who has power, right? And even showing furthermore that you don't have power over your own body and you don't get to make your own choices. Would anybody force someone to have chemo if they had cancer? Do they have a choice in it? I mean, it's a healthcare decision, right? How come every other healthcare decision is based in the consumer making the decision about their own body? Every single other healthcare decision. Except trans healthcare, true. And intersex folks. True. So when we discuss reproductive justice, we have to take into account that folks who are on an extreme to the point where they think it's okay to kill people and bomb clinics and then also call themselves pro-life is very problematic. Even the wording of that. The radical right really has their genius at their language. That is something that the far left has not mastered, but utilizing words like partial birth abortion, propaganda, thank you, late term abortion. Also, those kinds of things typically only happen when there's something that's gone catastrophically wrong. And they're being like, those incidents are being used to then exacerbate the whole conversation and make it sound like people are murderers if they're making the choice to not bear a child. So I'm going to say a few things that might be a little strong. Abortion is birth control. It is literally controlling birth. It is a form of birth control, and it is an important one. And it keeps folks out of poverty. It lowers child. You have a child that you don't want. I mean, I don't know the exact statistic, but I'm going to say it's probably 10 times more likely that that child is going to be abused or mistreated in some way. What happens to that kiddo? They end up in different systems, addiction, things like that. They're coming to see one of us, and it goes on and on and on. And it just, and intergenerationally, the trauma that gets passed when folks have abortions and, you know, no one I've ever talked to has wanted to have an abortion. It's like being like, yeah, I'll have my appendix removed. Sure, let's go for it. Just cause it's not bothering me or anything. Typically, folks do not want to use it, but here's an unpopular thing. Some folks do use it as birth control, and I think that's also okay because again, it is their choice. It is accessible, or not so much anymore, or it was accessible for a reason. The feminist Marilyn Frye wrote a piece about it in the 70s, and she said that she equated, here's where, you know, trigger warning, she equated a fetus to a parasite because the literal definition of a parasite is something living off something else. And she said that men did not want abortion to be legal because they too were parasites on AFAB people and women. And so that was her extrapolation. So there's the unpopular thing I'm going to say, but it's an interesting argument that I don't think that we take into account. And I think that we take that out of the context and think about labor by AFAB people, emotional labor, expectations, differences in gender norms. There is a lot of pressure for women to do the work. Additionally, women or AFAB people are the ones who are upholding the patriarchy. The folks who benefit from it don't necessarily have to hold it up because other folks are doing it for them and enabling the process. And that's what we're socialized to do. So again, strong opinions, and also I think worth talking about. So when we break a little bit later, I'm going to give you all some time to think about what I just said and to speak about it with each other, whether you're having a strong reaction to what I said, or you're resonating, or you feel like maybe there's a different argument in there, what the logic is, and even looking at what your personal opinion has been about abortion and where that came from and was informed, because not everybody is automatically pro-choice. Not everybody grows up in that environment. I mean, obviously not everybody, but I mean, folks who are pro-choice sometimes come from a place of being anti-choice and then learning differently. I just had a conversation with my barber who was like, oh yeah, my girlfriend had an abortion when I was 18, but he's anti-abortion. And so I had a long conversation with him about that. And I said, what would it be like if you were a dad at that time when you were young? What would your life be like? How would it be different? And why doesn't somebody else get to make the same choice that you do? So I think people automatically take this conversation, which is gaslighting, to, well, I'm not okay with it for me. Again, what we, not again, but what we want for ourselves or what we need for ourselves is not something that we need to exercise over other people. And that happens in a lot of different ways too. I think this is the most major way that it happens. Thoughts, comments, questions?
Humans, we are the cockroaches of this planet.
Mhm.
So even within the aspect of why are we forcing creation on species that really should not be billions and billions and billions?
Agreed. So the comment was made about climate change and the impact that humans have on the earth. I'm just saying this for the Zoom folks. The impact that humans have on this world and how we are much like cockroaches and we really don't need to procreate any more than we have already. Mhm.
I'm curious how your barber reacted to that conversation, and also give you props for, I'm picturing you having that conversation in a very nice kind of a way and giving you props. I think that part of what's challenging is that, like, I know I have this visceral reaction when I like hear someone who isn't pro-choice. So I give you credit for being able to have a conversation like that. And I'm curious, like, just how that went and if he was able to come around at all and see where you were coming from.
Yeah, I went back to my dyke barbers after the conversation was longer and it went like this. This country is going to crap. Really? Yep. And then, you know, he's a Latinx guy who grew up in poverty, but is now a business owner. And he wears shirts like lions, not sheep, and is into guns and stuff. And so I was like, yeah, I think we've, I mean, there was another piece of the conversation that happened. It was a different conversation about just some invisibilizing stuff. He was like, yeah, I have some friends in Mexico. He goes down to Mexico a lot. He has a shop down there. I have some friends in Mexico who say that they get beat up for being gay, but I've never seen it happen. I was like, so you need to see it happen. Okay, anyway, we could talk about that today, but yeah. He didn't, but he did hear me about the abortion piece, and he was listening intently. Somebody just said to me in a training the other day, when a teacher says no right away like that, they're usually thinking about it. And so I thought about that in the same way, that he's going to process that a little bit.
I think some of you have heard me say this just in relation to body autonomy. Just in terms of body autonomy and the work that we do, just in terms of the nature of being trauma focused and how that's different than being trauma informed. And I've worked with people who knew as adults that they were conceived from rape, from sexual assault, from incest, I've worked with people who felt who were faced with the decision to what to do after becoming pregnant after a sexual assault themselves. I mean, there's a whole gamut of things. And I think when we look at that, our job, I mean, personally, I have my own beliefs and choices, and I think that aligns with the work that I choose to do as a social worker. It's supported by my board and the ethics on my board, but also just in the terms of being promoting and empowering. We know when we give choice, we're increasing the sense of empowerment that trauma victims already have, which is, you're traumatized in whatever capacity. And just in doing that work, and it just really solidifies for me why my clients know themselves, right? They are the facilitator of themselves. I get to be along for the ride, which is also what I think EMDR really makes for the sense of self-determination and autonomy. Like, what is it that works for you? Where is it that you want to go? I talk with people who have had poor therapy in the past, from people who want to integrate their parts. And that's our goal, is for, but, so I get this whole slew of like, maybe what would you like? How does your system work? And to me, it doesn't feel different. I don't know. I think, again, very strong feeling, similar to Olivia, very similar. Autonomy, like, what does that actually mean? What does being trauma focused actually mean? Just in the work I experience, even with adults who, when we do these thematic history takings, we've processed some issues around abortions that they've gotten, and how that kind of, even in the EMDR, jumping after leaving, or medications to abort fetus, even when it's the right choice. Even when it's the right choice, I felt no guilt, but there's still a trauma, there's still a grief reaction. Murder, being selfish, or I don't know. I would say, have you talked to people who have had medical procedures? Talk to people who have that and really looked at. Now, I don't know. I have lots of feelings about it. But from the work I do, it makes sense to me.
Yeah, you brought up some good points. I mean, what is being trauma focused around this, around reproductive health and justice? There's a reason we call it reproductive justice, right? It is a bigger issue. It's a human rights issue. I also think when we talk about rape, when we talk about sexual assault, incest, or what have you, and saying, oh, okay, if you abortion, if you were raped, we are then making a judgment call that something bad happened to you, so it's okay to do this. And it's a justification and a judgment. And it's nobody's business, frankly. And the last time I checked, per HIPAA, per privacy, all of that, it's nobody's business, right? But yet there is this huge public commentary about it. And what's interesting is, if you do get an abortion, take Plan B, do something like that, there is often guilt and shame from the societal messages. And there's an additional self-gaslighting that's going on there. I mean, it's not an easy process, even to take the Plan B pill. It makes you pretty sick. And then I've heard people say, well, I guess I deserve to feel that way. Even though essentially we don't even know if conception has taken place. So if you want to determine, you know, what conception is, and then we get into these really in the woods arguments about when conception happens. In Indian culture, we believe at 13 weeks. So does that impact what that looks like? Right. And so it's a very interesting thing that there's just so many layers to it. Whereas we don't say, oh yeah, you need to have such and such surgery on your ankle or whatever, like, and then blame the person for falling or getting injured. Right. And I think what the issue here is on a larger level, which a lot of us can relate to, is this general lack of empathy for other people. Well, I would never have an abortion. Okay, well, then don't. That's why it's called choice.
Except most people think they won't until they're in the position to decide.
I think it's a fine line between legislating personal and religious morality. That is your personal and your religious and your spiritual morality. That is totally fine. But when we switch that over to legislation, then you are not allowing other individuals' personal or religious or spiritual morality to come into play. That's where it becomes dangerous. And it's abuse. It's abusive. Yeah. Thanks for sharing.
Thank you.
Hi. So agreed, echoed everything. And I was looking ahead in your slides and saw ableism is coming next. You know, one of the main reasons I invited you to do this, I mean, many reasons I invited you to do this training, but part of it was so those of us who are leaders within ICM could have discussions about kind of where this may show up in trainings and our advocacy, et cetera, et cetera. So what was interesting is I do have a lot of people who follow my work, specifically in ICM's work, who do identified as physically disabled or having a mental health disability. And a lot of those contacts I've met through the DID community and Healing Together. And even in Dissociation Made Simple, several of the folks I interviewed are like, are on serious high alert about eugenics and our field being like, we want to fix brains so that people don't have problems anymore. And it doesn't, you know, continue to populate mental illness, you know, and all that. So one of the criticisms, I actually got it from two different people when we posted our reproductive justice statement. And I told you this, you know, at the Anti-Oppression Task Force was, well, what about people with disabilities? Because a lot of people in some facets of the disability community or people with disabilities can feel a little activated when you talk about abortion on demand, especially if a mother does not want to carry to term a child who may be likely to have disabilities. And I tried to really navigate it as validating what they are feeling as something that's very legit and real. I don't know if I really have a question for you, other than I know since you do a lot of disability advocacy as well, kind of how do we hold space as advocates and for both? Maybe there's no easy answer here, but I wanted to put it out there just to let you know that this is some of the talk some of the comments that have come our way.
Thank you, Jamie. That's a great question. And I think part of the answer is whose bodies are we legislating? We're legislating black and brown bodies. We're legislating people with disabilities, right? It's like, okay, those are the people that are okay to legislate. And then other folks tend to have, it's not everyone. We're legislating the poor and the folks with the least access on the margins. So who does it impact? And yes, this reminds me of the fact that when I used to do LGBT Speakers Bureau panels at Cal State Long Beach, without fail, we would get the question, nurture versus, is it a choice? Is it genetic? And my answer would always be, to me, it was a choice because I made the choice to be who I am. And if I didn't and if it was genetic, then I would still make that choice. So it doesn't matter. But when we start getting into the weeds about nature versus nurture, what we're talking about is eugenics. What we're talking about is, can we find that gay gene so we can slice it up? Then it becomes Nazi-like. Then it takes it to a whole nother level. And when we're talking about folks with disabilities, it comes down to productivity. Can you produce? In the same way that in a lot of countries, if you're a lesbian, as long as you can still have children, or you still will have children, you're still considered a woman, or you're still considered a generative part of society. And if we're looking at some of the tests that get run, some of the genetic testing that goes on, there's so much more access to testing amnio fluid, stuff like that. And then making a choice that if this fetus is going to have a disability, well, then I'm going to have an abortion. And again, it comes down to those in our society who are not generative for cis, white, hetero men and the things that benefit that. Then they automatically become this dispensable part of our society, which is so problematic on so many levels, because not only are folks already invisible, but now you don't even get to the table. There's no table. There was a quote, let me see if I can remember it. Yeah. A seat at the table and visibility. Great. And that's all very different. Those are all very different experiences. And they don't always go together. In fact, often they don't. So didn't really answer that, but I think that what we're talking about, yeah, it's not an easy answer, but I think what it comes down to is the larger societal message that if your fetus has a disability or will have a problem, there's a decision to opt out. There's the opportunity to opt out. And frankly, that doesn't make a whole lot of sense. Who this person is, and you don't know what the uniqueness that they're bringing into this world, how that's going to impact. So then it begs that question, right? Where's the line? When I say pro-choice, I mean pro-choice, even unfortunately for those folks who are making that decision. I have to believe it across the board, right? But it is extremely problematic and pervasive. There's a lot of layers to this argument, but I think when we get down to it, it really becomes about oppression. If we are not talking about oppression when we're talking about reproductive justice, then we're not having a real conversation about it. Folks who have privilege around this area by having access believe that because it's not a problem for me, it's not a problem for anyone. Is the danger whenever we step over that line and say, it's not my issue, so who cares? Then why do you get to make a decision for others? So, can I have you guys break up into groups? 3, 4? Up to you guys, dealer's choice. Same? Okay, we've got to vote for the same groups. And I'd like you to take a few moments to talk about what we just discussed. And the complexity, as I mentioned earlier, of your own beliefs around it, whether they've changed, what it's been informed by. And just, if you have any responses or reactions to some of the things that I said that were pretty strong. So we'll go ahead and do that until 2:30. I notice I say that a lot. Dive back in. Hi, folks in Zoom land. All right, so we spoke a little bit about some communities that experience oppression, right? LGBTQ plus folks. We spoke a little bit about reproductive justice. Again, we're not going to be able to cover all the topics, so just highlighting a few of them. Maybe at the next retreat, we'll highlight 100 others. Okay, so ableism. As I mentioned earlier, ableism is one of those that I think is very silent or invisible in a lot of ways. And we've spoken quite a bit about invisible disability here. And as you all know very well, mental health concerns, mental illness, diagnoses, those are likely most of the time for most people invisible disabilities as well. So, what is ableism? Ableism are the practices and dominant attitudes in society that devalue and limit the potential of persons with developmental, emotional, physical, or psychiatric disabilities twice. These attitudes are and practices are discriminatory, right? We talked about discriminatory meaning prejudice plus a system or institutions behind it. An ableist society is said to be one that treats non-disabled individuals as the standard of normal living, in quotes, which results in public and private places and services, education, and social work that are built to serve, quote unquote, standard, I'm going to say average people, thereby inherently excluding those with various disabilities. An ableist society is said to be one that treats non-disabled individuals as a standard of normal living, which results, this is a typo here. So, what are some examples of ableism before I give you the answers? Yes. Mm-hmm.
Yeah. But as somebody with ADHD and autism, right, I am labeled as disabled, right? And I'm working with clients who view themselves as disabled. And it's not that my brain is broken. My brain works different than the average person. My brain is fucking fabulous, as is the brain of an average person. I don't think I'm special, but I think I'm amazing, right? Just as every human on the planet is amazing, right? But what's disabling, it's a society that says we only have room for one way of doing things, right? If we had ramps for everything and cars that people without legs could get into, whatever, would that suddenly be a disability anymore? Or would they just be fucking different? And what's wrong with being different? Well, we don't have space for that. Thanks.
Great point. Society is the one that's disabled because of its expectations and social norms.
And Roshni, like I told you, this is an area where I get mixed opinion from advocates. Like even several different advocates I interviewed in the same book, where it's like, no, it's the euphemisms you use, like differently abled, that's insulting. That I've heard some people say, like, just say disabled, just say poverty, just say these things. So yeah, this is where I don't really know other than to ask the person what language works for you. And this is where to be accommodating and anti-oppressive, it is hard work because you may need to just, juggle different people and different students' identifiers or how they see the world. Like in the trainers meeting the other day, we were talking about when a student asks you a question, be prepared to answer it in several different ways. Don't just give them your answer, because especially in EMDR, you may have to explain it several different ways. And none of them are necessarily bad. So, I mean, Mike, I embrace your point fully. I think it's very social model of disability, but I've been in like the middle of row conversations with advocates who believe differently.
Point, counterpoint.
I have two, and whatever label you identify with, I think you have the every damn right to choose your own labels. And so I'm not going to tell anybody they're disabled or not. But I would also argue that what you're describing is internalized ableism, right? They've now believed what people have told them for years.
Retort? No. I love that. I think you do have to represent more than just your opinion about stuff. When you're talking to folks, I think there are a lot of answers. Sometimes I'll say, well, this is what I believe, but other folks think this way. And hearing what you both are saying, you know, some people do not like the word disability. Some people have taken it back as an empowering thing. Folks have taken the word crippled back. And I know a lot of advocates, disability advocates who identify with crip culture. And so it's always challenging when we take a word back because there's always going to be some people who don't necessarily agree with having that word taken back because the charge is heavy for them. So it's understandable. And there's just so many different experiences. And again, this is an umbrella term that encompasses a lot of different people with a lot of different experiences. And I see that a lot of folks are utilizing neurodivergent, neurotypical more so, and it is becoming more of a popular thing to say, which I think is an empowering thing to think about the fact that actually it's not a disability. Because I have ADHD, it means that I think differently than the typical person. That the way that I get to that point of coming up with something or answering a question or what have you is going to look different for me. And it's very validating to feel like, oh, my brain just works a little different instead of, oh, you have ADHD, you need to be on medications. And I think that it allows a person to be empowered where likely they have been abused. I'm going to say a lot of folks with learning disabilities get abused and they're not understood by parents, by teachers, what have you. And so it's about masking and forcing that person into what they're supposed to look like, how you're supposed to show up. And I think one of the most illuminating things I've seen is like a meme that was like, you know, people with ADHD or people with neurodiversity, we're not stupid. We know how to do the thing. That's not the problem. It's the barriers and the obstacles and the overwhelm that gets us to that place.
To be continued this evening.
Conversation to be continued this evening. Mhm. Mhm. On the deck with a guitar. Ding, ding, ding. So some examples of ableism. We've talked a little bit about this already. Lack of access to a building. That was brought up, right? No ramps for people with wheelchair access to the front door of a building, or access only through the back door. Thank goodness. That's where this is going. Hey, not too long ago, right? That was a real thing. Different fountains, different bathrooms, things like that. So I think when we talk about ability and disability, oftentimes people are only thinking about wheelchair using folks. And they're like, oh, okay, I can wrap my head around, you need a wheelchair, you need, you need a elevator, you need a ramp, something like that. But even that is so far out of most people's heads. If you've ever been anywhere in Europe, you'll know that if you're a person with a disability, you can't get around because there are stairs for days. It's like they're anti-elevator and anti-ramp, you know? I mean, I know that the infrastructures are quite old, but I just feel for people who are wheelchair using or have any type of disability or injury to be moving around those areas and not have access to a lot of things. I don't know how folks do it. They don't. You're right. You're right. It's very sad, but true. Yeah. Another example, lack of assistive technologies during conferences, right? I mean, you know, captions are helpful, you know, being able to see what's being said. I find it helpful. I think also just folks letting us know when they need an accommodation and how hard that can be to do. I often will say it multiple times because I think folks don't want to impose or are so used to masking that they're not even thinking I can ask for that, right? So even in giving permission, there's a lot of permission that's needed and maybe even needed to be repeated. Not having events accessible to public transport. as many people with disabilities cannot drive, people with physical disabilities, getting places, utilizing access. In California, we have a program called Access where they'll pick you up, they'll drop you off. But there's a hard time. I was just at a party with a friend who's a wheelchair user and was having so much fun, was having the time of her life. And here comes the car. And it's like, okay, time to go, you know? So just recognizing that there are a lot more restrictions. Blaming the person with a disability about being victimized, such as they were annoying, so they deserve the bullying. Right? So gaslighting around that. Denying a person's decision-making capabilities for their own life, such as forced sterilization, decision-making in terms of housing or whatnot. You know, I think that you see folks who do not have the ability to advocate for themselves for whatever reason. And there are assumptions being made for them, and there are choices being made, and they're not being treated like a person. Not talking to a person with a disability, but instead talking to the able-bodied person with them or about them. Talking to them, talking about them in the room as if they're not there. Refusing to give the level of respect due to a person. Making assumptions that because you have some type of disability that means X, Y, and Z. That means I'm not going to be able to communicate with you, or you wouldn't have had this experience. There's a great organization in the Bay Area called Sins Invalid, and they really focus on art in all the forms about sexuality and disability. Because folks with physical disabilities are often looked at as asexual. And maybe even agender at times. But unfortunately, there is a higher rate of sexual abuse and other types of abuse for folks with disabilities. Often by caregivers, often financial, emotional, sexual, and physical abuse. It's rampant. Using derogatory labels. I can't even say the R word, sorry. It's too triggering. I won't even say the other one as well, but derogatory labels. I mean, the R word is still in the DSM. And at this point, I don't think people even realize it's a clinical term because it's overly used in such a negative fashion that I think our field needs to catch up to that already. We need to change the language, right? Intellectual or developmental disability is far more accurate and far more neutral of a term. The misrepresentative of disabilities in the popular media and in the news, lots of stereotyping, which we've seen time again with folks of color, queer folks, trans folks, right? How many movies in the late 80s or in the 80s and before was always like, if you're queer, you must die at the end of the movie. You will have tragedy, you know? And in the same way, folks with disabilities, you know, even like, wow, they found love, this and that, you know, it's like, it's very sensationalized and very inaccurate. Especially DID. Oh, I can't. That movie Split. It's like people with dissociative identity disorder are going to kill you because something is going to take over and they're going to murder you, not recognizing actually this is trauma. Yeah. You're like, no, I'm going. Let's do it.
So we actually have a whole chapter in Dissociation Made Simple about the media issue. Yes, it's with, I would say, all mental health, but really specific to DID. And one of our contributors, who we hope will soon be on the ICM team, just said it so bluntly. We have to dissociate the connection between violence and DID. Because that is what media has given us, that it automatically is something that's violent. So thank you for going here with this.
Yeah, absolutely. Nothing bothers me more. Well, a lot of things bother me, but that's one that is really a huge pet peeve. It's an endless list, right? Do you guys have time for that? You want me to list out all? Yeah. I'm always hopeful when there's a movie that comes out that I'm like, here it comes. No, same old story. Same old thing. Reinforcing the myths and stereotypes, creating additional problems, creating more isolation and invisibility. Right? That power over is built on myths and stereotypes. Using people with disabilities as inspirational porn. I've heard the word thrown around, trauma porn. And I do have to say that I think that there are a lot of therapists out there who, despite the fact that we don't need to hear the story, want to hear any story, want to hear that trauma and have this idea that it needs to be spoken. I need to hear it. And, emotional masturbation. Yes. Lost my train of thought. I think we have to ask ourselves, why do we want to know? What difference does it make? Why is it important to do that? So Steve and I have an inside joke which is now an outside joke since I'm sharing it with you all, where I call CBT self-gaslighting. Trauma-focused self-gaslighting. And in the same way, exposure therapy is saying it over and over and over again or experiencing it, right? Until it's less triggering, essentially. And that feels kind of violent, I'm not going to lie. So no offense to anyone who does, exposure therapy, but my personal opinion is that it's really intense. There's an element of gaslighting, and we know that it doesn't really actually get to the traumatic memories. We know that it's still just talk therapy and that it's only affecting the neocortex, which is not where that traumatic memory lives, or any traumatic memories for that matter. Assuming that people with disabilities cannot be autonomous or independent, even holding the door open for someone and assuming they can't do it themselves. You may feel like you're being nice, but what message are you sending? Able-bodied people using disabled parking or toilets. I can't with that. There's such limited resource and access that it's just so crappy when you see somebody parked in a spot and they just assume that they're entitled to it. Or, someone gets out of a car, someone with a disability, and you look at them and you're like, that person doesn't have a disability. That's what you're thinking right now. Yep. I saw it in your face. I was like, yep. Yeah. Had a serious back injury and my doctors were like, do you want a pass or something? And I'm like, no, because I know what that look is and I don't want to deal with it. And then there's this minimization, like with trauma, right? Well, other people have it worse than me, right? Well, your experience is valid. Even though other folks struggle, your experience is still valid. It is not a contest. It is not the woke Olympics. Able-bodied people assuming that disabilities are always physical. Invisible disabilities are that, very largely invisible. And people will not hesitate to say something to you. Strangers coming up to me being like, you're too young for that. Literally, the doctor the other day said, yeah, you can actually move your neck a lot. I said, yeah, I'm flexible. That's why doctors don't believe I'm in pain. Literally, I've had doctors tell me, you're flexible, so it doesn't seem like you're in pain. It doesn't look to me like you have pain. Wow. Rachel said, even Black and brown bodies being told by medical professionals you can't experience pain. We were just talking last night about those thermometers. I'm going to use like a gun symbol, but the thermometers that they point at you not being effective for Black folks. Your finger in the hospital to check your pulse, not effective for Black folks. Someone did a research study that Lisa was telling us about. Mhm. Right. Mike said, heaven forbid we should test this on everybody before we release it, right? I mean, that was a big, was a thing stuff because I had a lot of Black friends who were like, I'm not getting the vaccine. And right, exactly. And it's like, actually, the vaccine wasn't tested on Black and brown folks. It literally was not tested. And I think having, what's that? It's being tested in this moment. No. Mhm. Mhm.
Growing up, and the nurses would always tell me that I have a high tolerance for pain, which I, for a long time, was like, oh, that's great, I have a high tolerance for pain. Then I have another doctor, I have a new doctor who I fucking love. This, you can tell that she's trying, white person. So not bad, like, it's a white person. But she was like, she asked me, she was like, why do you think that you have a high tolerance for pain? And I was like, oh, doctors have just always told me that. And she was like, but why? And she was also a doctor who told me she had to sit me down after I had surgery last year because I kept refusing pain medication. And she was like, you're not going to heal if you don't give your body time to rest. From the pain medication wasn't for any reason other than I had always been told that like it's a good thing that you are so resilient, because that's something else that I think people, at least I was always told, because I had lupus and because of some family trauma that I experienced, it was like, you are this really resilient person. So that became part of my identity, which then prevented me from asking for help, which then created more stress, which then activated my lupus. And so it's this like really vicious cycle that continued to happen. I think is really common because I have friends who have lupus who aren't people of color, and they are told very different messaging. No, we don't have the exact same doctors, but we're navigating the same types of doctors, and they get very different messaging. And so I think it's very interesting when you think about like this idea of ableism and also this expectation that certain people are just supposed to be more resilient, like genetically, or supposed to have that, like we don't experience pain the same way, which then prevents us from having access to the same resources, which could essentially like be life-saving or life-giving.
Thank you. Great point. I think there are so many myths around stuff about, oh, well, you're so resilient. You have to deal with that all the time. Resilience can be, I'm going to talk a little bit about resilience, but I want to say it can be weaponized. Self-care can be weaponized. It is a problem to assume that all of our experiences are the same.
But it's coming up. As Roshi, I want to thank you for mentioning, fat phobia, size, privilege in this culture. I've been very empowered in the past several years following a lot of advocates in the fat liberation movement who really have exposed like the junk science behind the BMI and the racist classist origins of that. But how, I'm a patient at a Cleveland Clinic facility, and it is still like a standard of practice in medicine. And, anybody who's overweight or larger will tell you going to the doctor is a scary experience when they lecture you about, well, if you'd only lose some weight. And usually, and my first doctor who did that to me was a fucking fat ass, that's how. But when I was 5 years old, like literally at 5, I have EMDR'd this, but I was supposed to weigh 52 pounds and I weighed 62 pounds. And he said, nobody's ever going to marry you as somebody like who was extremely overweight. And what was interesting is recently, I went to finally get my knees looked at, and I've had knee issues since probably before I was born, but especially with sports injuries when I was a teenager. And that was of course the first thing that came up, and I probably waited to go to a doctor a year and a half longer than I should have, because I didn't want the lecture. Like, if only you'd lose some weight, you'd take the pressure off your knees. And this is also kind of a cross section with my dissociation. When I was getting audited by this doctor, you know, or interrogated by this doctor, I finally, like, I hadn't totally forgotten this or dissociated it, but it was not so much in my cognizance that I was on arthritis meds for my knees at 19 when I was still young and fit and practically had an eating disorder. And even like leaving the doctor's office, I was still kind of doing this self-deprecation thing about my weight. And even Jeremy had to remind me, like, you were on arthritis meds when you were active and like, this is not about your weight. And that's a lot of what fat advocates are looking at right now, that yes, there can be some connections, and it's fundamentally me about being healthy in your body. And I still support a lot of that, but just to think of how many people who either have concerns about gender, how it's going to be respected, about weight, about ableism, withhold medical care for themselves, because it is a fucking shaming experience.
Okay, here we go.
So yeah, I had been struggling with my health, and the same thing with like Jamie. I like waited a year and a half longer than I probably should have to start going to doctors, but I was concerned about the reaction and stuff. So all this stuff, cardiologist is like, doctor, $100 worth of blood. I was like, all your numbers are one you up and down, and are like, how could you be healthy? I'm just saying, something has shut down. There's no reason for this. And then I fell this in June, and my knee has been hurting, and the doctor said because I fell I could get it looked at, and I've been saying they hurt. Anyway, it was a complex macerated tear of the meniscus and all this stuff. And my therapist said, don't go to the Cleveland Clinic because they will not do knee surgery until I go to the bariatric center. And I'm like, even if I refuse it or don't want to do a bariatric surgery, they will not replace my knee, even though we have this proof of the damage that's done. And it's from playing volleyball 6 hours a day for 6 years. It has nothing to do with the fall or my weight. Anyhow, yes, it continues.
Thanks for sharing. Yeah. Boy. Mm-hmm. Yeah, I had torn my rotator cuff. I had slipped and fell at a Trader Joe's on a fig nonetheless. Like it was like a cartoon fall where you catch air and then land on it. And it took over a year for them to believe me and give me the shoulder surgery. And what did they do? They did a different angle of an x-ray, and they were like, oh, you're bone on bone. So I think also, I think a lot of us are having that issue with arthritis where it's genetic or you've had it for a long time and you experience pain, but then you're blamed and you're told you did this to yourself. Yes, thank you, Mike. Let's not discount the AFAB part of this conversation of not being, what's that? You're being dramatic. You're histrionic, basically. Essentially, you're being treated like that. Right? For sure. I think that, oh, sorry.
So one thing too, and having a lot of chronic health issues and going for lots of different tests, and everything's, well, you should diet, and oh, what have you been, we don't see anything wrong, and maybe it's this, go to this specialist, everything's dismissed. And especially too, I think as a female, having it's that dramatic piece, and or you're too young for this chronic issue. Like I was 20 and having, like, my doctor constantly was like, It's a UTI. It's a UTI. You've tested me for those so many times and given me antibiotic, even though it's negative. It's not that. And one person said I should get tested for interstitial cystitis, which is a bladder like chronic condition, and sent me to a male urologist. And he was like, no, that's too young for that. There's no way. And he's like, do food diary and just different. And then finally went to someone else and that's what it was. But took about 17 years and different doctors to finally identify that a lot of it was also endometriosis, which is super common. So underdiagnosed else too and with everything of, oh, just tighten your like the most bullshit.
Thank you for sharing. Sorry you had that experience.
We're talking about things y'all are missing online. I was just going to say quickly, I think even these conversations and relating it to oppression, and thinking critically about power and which social institutions are given this like power of objectivity and absolute truth. And medical environments, right, where you're continuously that a person who is not in your body knows more about your body than you, and you're not given license to challenge ever, right? That challenge intellectual elitism, we're making these preferences, like this medical path is superior to another one, and so I think often even navigating that outside of our personal pain is just knowing we walk into environments of care that we're also then stripping away and giving up a lot of our autonomy and our knowledge and what we know to be true. And I think that's around the oppression idea about what prevents us from receiving care and how oppression becomes violence and how it becomes life and death in that way. So
Thank you, Lisa.
Yeah, just to even kind of piggyback off of what Lisa said, like it actually like astounded me how like 10, 15 years of going to female doctors and them telling me that my endometriosis, PCOS, and PMDD was all just like, oh yeah, well, like menstrual cycles are hard, and completely dismissing I'm like, okay, so I've been to the doctor in the ER like multiple times for this, for why? So that's normal. That's a normal menstrual cycle from other like AFAB people over and over again. Like, oh, okay, cool. So just again, the systemic, I think how it actually helped me look at like, how do I show up and oppress other people from my positionality, even if I am marginalized in some ways myself? Like, how am I aligning with the oppressor to benefit myself that is actually still hurting me, but then even more hurting other people whose experiences I don't personally understand because I don't have their lived experiences. So
One thing too, and just as a side with that of with parenting even, I've noticed of trying to keep that kind of thing in mind of, I think so often we tell kids like, oh, it's okay, it's okay, it's okay. But then thinking of, well, maybe not, maybe it's not okay. Let's hear what you're feeling because it's not really for me to tell you that it's okay. I can explain some of the things and be more comforting, but I don't get to just tell you that no, it's fine and force you into something. I feel like just systemically, we just force so much discomfort just to keep going and be productive or align with whatever crap we're told we need to be doing. So.
Thank you. I love this discussion. Thank you all for your participation.
And circling around to the being overweight again, lack of access actually applies to being overweight as well. And that's one thing that I don't know that everybody considers. Like if you go to a therapist's office and all the chairs have arms, or the chairs aren't designed, or they don't look like they're designed to support somebody's weight or whatever, that can cause a lot of really big problems. It can cause a lot of problems and concerts and musicals and all of that stuff. A lot of folks have to sit those things out, and it's pretty upsetting, actually.
Agreed. That makes me think of airplanes where they make you buy 2 seats. Ridiculous. A lot of folks who are on the skinny side are not even healthy necessarily. To your point, like that doesn't equal healthy. Or being too thin. There's like, you can't win one way or another. So this is the reason that queer, trans, non-binary folks and people of color do not access medical services over and over and over again. Who has a doctor they trust? Okay, I see. Okay, see a fair amount of hands. How many doctors do you have to go to get to that doctor? How many fingers? How many hands, right? Quite a few. Yeah. And it just takes one comment. And that's it. You're turned off. You're not going to go back. It's a vulnerable place to be, going to the doctor, period. And it's not accessible. It's not, I think that there's this saying like, this is not for me. This is not set up for me. This was not created for me. And you can very much tell that when you walk into a room, even with neurodivergence, loud lights, like lots of stuff going on, as if you weren't anxious to begin with. Lots to talk about here, and lots of folks in this room who've been very impacted by invisible disability, especially. Thank you for sharing. Appreciate your vulnerability. Are we all good on chat? I guess. Okay. Okay. Just making sure. Good point. Yeah, absolutely. Agreed. When I say please take care of yourself, I really mean it. So when in doubt, do what you need to do. Listen to yourself. I think that's also in society, capitalism, patriarchy, white supremacy is about productivity and about fitting into boxes. And if you're outside of that, then what does that mean for you? Where are the places in which you're invisible? Or is there any place where you're visible or validated or acknowledged as a full person? So what do folks with disabilities need? Look at this cop. Look at this cop. Wow, I just called him a cop. It's a Freudian slip. Look at this doctor who is as white as a sheet, weirdly, in this. Says, okay, what do I want? To make my own decisions, to be asked, information I can access, to be respected, right? What do folks want with disabilities? The same thing that everybody wants: to be seen, heard, to have choice, to have autonomy. So when we talk about ableism, there's so many layers to it, and it's great that we were able to touch on different experiences, access to resources, people's individual experiences. I think that it is so important to recognize that this is actually, again, yet another huge umbrella that a lot of folks are shoved under, right? But it looks really different for each person's experience. And there's not really a sense of community in that, right? In that umbrella thing, it's just like shove them all there because we don't, just put it out of sight, out of mind. And I hear neurodivergence being talked about more. I hear certain things. I hear invisible disability. It comes up more and more, but we are very much in a niche. We hear these things and we talk about them. And luckily we have this platform where we can actually explore this stuff. And we can have these hard conversations. But there's still so much more to discuss and unpack. So again, just scratching the surface of these topics, we could do 5 days on ableism. Easily, without breaking a sweat. So what are we going to do with all these problems? Cry, sleep, eat, not go to the doctor. Yeah. So getting Kittens. Yeah, foster kittens. There you go. We talked about allies being part of the LGBTQIAA P2S plus communities. 3 times fast. What makes a good ally? No allies in the room? What's that? Humility. Listening. What'd you say, Mike? Oh, same. Listening, but speaking up when it's hard to or puts you at risk. Using your privilege. Absolutely. Awareness of self before you're out like saving people. So not coming at it from this place of I'm here to help you, but lots and lots of humility.
Paula's adding empathy, willingness to be uncomfortable, and Dr. Kelly is saying courage. Biggest thing I've learned from Dr. Kelly in our work together is her question, what's your action? Every time this question comes up, I hear Dr. Kelly saying that. So I think it's obviously using what privilege you have to take action. And sometimes that's in very small but still impactful ways. And other times it needs to be proportional with the level of privilege you have.
I love that. What's your action? Don't just talk about it, be about it, do something. Saviors need not apply. Agreed. Agreed.
Posting about it when you help someone or do something that like that savior thing comes to mind is like, just do it and you don't need people to see it or recognize other people to see it.
Not doing it for acknowledgement. Not, doing what you're doing when no one's looking. That's what really matters. That's a real ally, right? When no one's going to see the impact of what you're doing, but you're still doing it. Commitment. Asking the person directly what they want or need from you. Not assuming, not thinking I know what's best. Asking for permission and consent. Can I support you? Should I sure. Okay. Sam, you can, oh, you know what? I think I have to get back into Zoom now. Hold on. And what? There. Sam, you can go ahead and start speaking. I'll
Yeah, I
have
was
you
gonna
up in a
say,
second.
I was gonna say, like, especially from a therapist standpoint, like patience and building trust and rapport, since, folks that have been oppressed and hurt by systems and the ways we're talking about really need us to sometimes go at their own pace, right?
Thank you. Patience is a big one.
It's not a destination. And so I think I think this word competent comes up a lot, like in cultural competence. Culture, again, doesn't just mean black and white, but culture means it's this much vaster thing. But I hear this this idea of being like competent in areas a lot, especially for people who are outside of the community. I think sometimes when I see the word ally, I see it more as like this performative gesture versus recognizing like you shouldn't need to tell me that you're an ally in any space. I should just know that already. And I think that's the big thing.
Even having others name you as an ally rather than you saying it for yourself. That's a big difference. Someone else calling you an ally because they recognize something that you are doing or a way in which you're showing up versus calling yourself an ally. Mhm. So we talked a little bit about what it means. Well, we talked about characteristics of a supportive ally. What does it mean to be an ally? What's your job? I think we covered a little bit of asking permission, consent, not assuming, having humility, showing up. What's your action? Anybody want to add to that?
I think sometimes, the difference between an ally and an accomplice, it suggests that you're not leading this thing, that you're willing to leverage something and to lose something and to also be a part of, as opposed to kind of guiding. I don't know, there's something about that word that feels more action oriented. And so sometimes when I think about good allies, I don't know what that means, but like that they're accomplices in the work that we're doing.
Ride or die.
Just want to read for the room in here. A couple comments coming through. Dr. Kelly says, calling out injustice and challenging the status quo. Hold a good space to really listen. Sam says, believing someone. Dr. Kelly also adds, speak up and challenge the system. And for me, Lisa and I had this conversation. It's really about being willing to take a risk, especially when you're in a position of power that you may lose something. You may lose friends. You may lose customers. We've had people send us hate stuff and withdraw business because we're supporting the BIPOC cohort. And I know that scares a lot of people, losing business, yet I don't think for me it's a risk I'm willing to take. I can't put that on all of you, but I know a lot of you have been vocal about joining me in that action as well.
Thank you. Thanks for your comments. Those of you at home joining us from home. So allyship is when a person of privilege works in solidarity and partnership with a marginalized group of people to help take down the systems that challenge that group's basic rights, equal access, and ability to thrive in our society. So I think you all really touched on this, right? Helping to take down systems. How do systems get taken down? Audre Lorde, burn it. Audre Lorde says the master's tools will not dismantle the master's house. And I think that that is very poignant because folks on the inside have to make the changes. They have to be willing to take risks. They have to be willing to give something up, to sacrifice their own privilege, to stand up. I mean, that's huge. You're putting a target on yourself as an ally oftentimes, and you're stepping out of a place where you have privilege. So what is allyship in action? Dr. Kelly said it well. What's your action? Stop talking, start doing. I'm always wary of people who are talking about stuff like that because I'm like, you actually don't need to talk about it if you're doing it. So it's not about paving the way for new investigators with common goals, but rather to walk the walk with them, alongside them. Sharing the lessons learned and developing methodological strengths from bench to bedside to the community and back. Getting your hands dirty, getting in there and doing the work. Trusting in each other to approach difficult conversations despite our differences in lived experiences. I know when I walk into a room with an ally, a Zoom room or what have you, and I know this person's my ally, I'm not going to speak up about queer stuff because I know they will. So I don't have to. So I get to take a back seat for once, right? That's a real ally when you know you don't have to speak up because they're the ones who are going to do it. Trusting in each other to approach, oh, sorry, just said that. Did I? Yeah. Sincerity and authenticity in wanting to work toward the common goal of reducing health disparities in Black and Brown communities. I mean, I feel like we all can be working on this stuff. There are just so many needs that we've talked about today. A lot of folks brought up how we're using privilege in allyship or for allyship. It can be a small action, but it often has a very big impact. Like I said, walking into that room knowing that person's got my back. You don't have to make a big grand gesture to be an ally, right? Doesn't even have to be anything anyone saw. Anyone can be an ally and leverage their place of privilege. An ally can serve as a mentor or a voice for someone who doesn't have a voice. An ally can also enhance the culture of inclusion by engaging with their marginalized colleagues and providing support for their daily lived experiences. We've had a couple of these already said. So ways to be an ally and a friend. I think being a friend is really about allyship oftentimes, right? They say the best kind of friend is the one who defends you when you're not in the room. And that's true allyship, right? Being a good listener, a couple people said that. Being open-minded, willing to talk. Willing to talk. I cannot stress that one enough. There's so many hard conversations within the LGBTQ plus community that folks are not willing to have. That drive me mad. Because if we don't talk about it, then how do we figure it out together? Being inclusive. Don't assume that all your friends and coworkers are cis and straight, that they are even assuming somebody's ethnicity, race. You don't know. Just because they look a certain way doesn't mean that, right? Not making assumptions, give people the space they need to be themselves. Racist, homophobic, transphobic comments and jokes are harmful. Let your friends and family and coworkers know that you find them offensive. Stepping in, that's one of the biggest things that an ally can do, because again, there's an aggression, not a microaggression, a macroaggression. And again, I have to speak up, and it's emotionally exhausting. I think there are so many things that are still okay for people to joke about. Having worked in the rape crisis movement for so long, prison rape is something that is still socially acceptable to joke about. And yet prisoners are traumatized day after day and treated as if that's par for the course. You committed a small violation and now you deserve to be sexually assaulted. Yeah, that's very much a common belief. There's a great organization called Stop Prisoner Rape that is really amazing in working with folks who are incarcerated to empower, to provide education and support.
One thing that's not on here that I think is big, at least for me, is also talking to our children. I know I have a 9-year-old, and it's amazing how much of this stuff she comes home talking about, and how much I talk to her and bring my views to her, and she brings them, and I can see her being an ally to people, which makes me really proud. Just, like, have conversations around, yes, girls can marry girls and boys can marry boys, and sometimes a girl is born a girl and then changes, just different conversations. I find that I'm educating her, and then she's educating her 9-year-old friends, which I think is also big in the next generation.
Agreed. Who's talking to our kids about this? Why are we not talking about these things in school? I do have to say my 14-year-old nephew started high school, and he's taking a diversity and education class. And I just love that they have that there. And he's saying certain words to me, and I'm just getting thrilled because I'm like, damn. But then we're having conversations about some of the rap he listens to, and I'm like, that's just not amazing the way that they're talking about women right now, in this. You want to say something? You want to say something? Okay. So, first things first, confront your own prejudices as an ally, even if it's uncomfortable. Just because you're an ally to one group doesn't mean you're an ally to every group. We all have a lot of blinders. We see the world from our perspective, and usually that's about it. I mean, I know people in this room and on the Zoom are a little bit different because we're in this field, we're doing this work, we're in an organization that's trauma focused. But for the most part, I think a lot of folks just shy away from things because they're too uncomfortable and scary. And like that quote, it said, I'm just going to get nailed. So I'm going to stay quiet, not participate, not grow, not take it in because I'm terrified and I'm just like sitting here frozen almost even. Defending your friends against discrimination and bullying. Believing that all people, regardless of their identity, should be treated with dignity and respect. So, a couple questions. Are you guys needing another break? Should we keep going? Okay. All right. Well, take bio breaks as you need them, and we'll keep moving through. How can I improve as an ally? And what communities can I step up more for as an ally? What are some of the communities that you feel like, I really haven't done much for this community? I really feel like there's a way in which maybe I need to take a long, hard look at myself and see why that's the case, right? Is it just not my specialty? And so I don't address neurodivergence, or, is it something that just hasn't come in front of me? Hasn't been in my life or my experience, right? Even more so important to become an ally, to learn, to educate yourself about it. Mm-hmm. Yeah, sure.
I will take a risk here, get honest with this. Like, to this question, because I know I'm actively addressing this right now, it is people with disabilities or people who are differently abled, if you will. I think it's twofold, my blind spots in this area. One is, as a business owner, it takes a lot of work and it is a lot more expense to be truly accessible. And, in the capitalist hellscape in which we live, that is something, I look at. And if I have resentment boil, I know that's some of why I get in the way, that can get in the way. And so it's something I'm looking at. And I think another big blind spot for me is, and folks in the DID and DD community, we have a lot of discussions about, is it a disability or not? Is it a disability? Is it a superpower? Is it both? And most of us land on it's somewhere both. Not until recently have I considered that I technically qualify as someone who's disabled, because I've overcome it. I've succeeded by all the white man standards. And, part of this goes into inspiration porn. We laud people who can overcome it. And we chide people who need the extra assistance or aren't producing, kind of as you said. So yeah, admittedly, this is probably my hugest blind spot. And those are two big reasons that I'm looking at as to why. But I was very impacted by your comment, Mike, about internalized ableism.
It's painful. It's very painful. Thank you for sharing. Internalized racism, internalized homophobia, internalized ableism. We don't need society's negative messages. We got them already in there, right? We heard them all as kids and we took them in from the media and they're in there. Mom did a good job. Sure. Mm-hmm. Please. You can.
and I don't know if this is a question necessarily for you to bear the burden to answer, but anybody in this room to answer. What I've really struggled with in terms of allyship, and poor Aaron Kelly and I have talked about this extensively. It's actually hard for me to go into allyship spaces because I become enraged and I will fucking go to jail. Excuse my language. And I'm totally fine with going to jail. And I've told Aaron, I said, I see all these things at times where people, obviously TikTok and everything, where, somebody's in a space and a person is being railed against because they're wearing the hijab, right? They're going, oh, get the fuck out of here. I said, I have never encountered that because I think I would kill somebody. So my aspect is, how do I, not to throw anybody under the bus, but how do I pull a beautiful Lisa Hayes, right? Oh, I'm curious, like, why are you being a fucking asshole right now, right? Or like, how do I pull a Roshni, right? And be that kind of like even keeled, because I'm not. I'm so like, you want to brawl? Like, I will brawl right now. So I correct. I know, and I understand that, recognize that, and it's the issue that I'm trying to find is, where can I have that balance of where I don't want to shut someone down, but at the same time, if I see something, you best believe I'm going to do something. So where is that? You know what I mean? If that's a question of appropriateness. I just want to validate your anger. And I want to, as you all know, do that emotion. It's not the first thing you're feeling. In an iceberg where you're seeing anger, underneath is betrayal and isolation and abandonment and hurt and a lot of. And so to be angry is understandable. It's a lot. And if you're dealing with it all the time, anger speaks to powerlessness. It feels way better to be angry than being depressed and crying. Way better, way more powerful. And so what I'm hearing is a loss of power, a very real loss of power. And then hearing people who have zero understanding of the loss of power is.
And Rachel, I know you and I have talked about this, but for me, part of that goes into like also my understanding of, and I think somebody else said this earlier, like my self-awareness and how I show up in spaces, because a lot of that has to do with my emotional dysregulation, which has to do with my neurodiversity. So like, how do I take care of myself in those instances so I can show up and not necessarily be the white person like yelling at everybody and shaming everybody into being anti-racist, because that's not going to work. So how can I work with my own strengths, superpowers, limitations, whatever, to what I uniquely can directly speaking out, maybe for you with someone, I think, depending on the day, for me too, because I will go to that extent, it really isn't going to help anybody. Just offering that.
Outlets, support, being seen, those things help. They're the opposite of microaggressions, right? Micro good things. Micro good things. Macro good things. Yes, absolutely. Macaroni and cheese. Yes, definitely. You raising your hand? No. Okay, you're just getting comfy. Gotcha. So, how do we do all this stuff? Roshni? Collaborative and supportive skill building. Invitation to collaborate, consent-based, right? Avoiding being directive. Even when we're confronting allies, even if they're off base. It's hard, but I will say to people directly things like, you know what, folks, autistic folks actually don't love the word spectrum now. It's not a popular thing anymore. I know it was used in the past, but just a heads up. And it's not a person with autism. Now it's autistic person. And so as I learn and grow, I share that information and I try to do it in the least violent way possible. But sometimes you have to remind people multiple times Because humans, we love our habits. It's hard to break them. Strength-based modalities. What's working? When I worked in wraparound, we would end our meetings with what worked and didn't work. Live feedback. We were working with families who did not want to be part of the program, who were forced and strong-armed. Be in this program or we'll remove your kids. So tell me what's working here, what's not working, right? Asking those questions. Focusing on strengths, but not in a way where we're weaponizing strengths. I'll talk a bit more about that. Watch for burnout, rescuing, hurried in our work, all or nothing thinking. When we are burnt out, which I think most therapists are right now, in Lisa's laugh. You know, if you weren't before the pandemic, you likely are now. Just because it's been such a shift. And the impact on the field of psychology because of the pandemic has been this influx of people who've never seeked out therapy services before, people who are experiencing depression and anxiety or addiction for the very first time. People, oh my God, the couples referrals that came in initially, it's like, you two really cannot be in the house all day with each other. Just right and left couples referrals initially during the pandemic. I was amazed. I love doing couples work, but I couldn't take on like 50 couples. Give flexibility to practice making choices, right? So inviting people to make those choices, being flexible, knowing that our choices change also, that they're not fixed, that we change as people. Building skills, that is like asking for needs to be met, finding what is already working. Reaching out. Reaching out is one of the hardest things to do. My therapist is on me. How are people going to know you need help, Roshni, if you don't tell them? Reaching out is hard. Asking for support is hard. I will say. Say again? Oh, Tammy said these people over here are great. They don't make you feel bad or anything when you reach out. They're always there.
Tammy, if I can share one of the first interactions you and I had where every time you needed something, there was a lot of, okay, I don't know if I can ask you this. I don't know if is it okay? I'm sorry to bother you. Is it okay if this is like 2 days late? And I had a come to Lady Gaga moment where I was like, Tammy, who hurt you? Because I am never, ever, 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 ever going to make you feel shame about requests. I'm never going to make you feel bad about needing something from me. I'm never, ever, ever going to make you feel a certain way about anything that we do together. That's never going to happen, ever. Because there's no shame in my game. And I can promise you that. And so, who hurt you, Tammy? Oh my goodness.
No, but Tam, even as you're saying that, like, I'm like, fuck, I'm far from perfect in that area. Cause I know all of you in this room probably have gotten the terse email response from me because I am so goddamn overloaded. Hence my tears yesterday, at the meeting. And it's just, that's not who I fundamentally am as a person, and I want to be that type that's like, I want to validate questions when they come in and not make people feel ashamed. And oftentimes when I know I do that, it is because I'm just so damn overworked. And how much of that is, again, the capitalist hellscape and what it tells us we have to do. But Beck, I do appreciate you very much for that. And you, I'm forgetting your name. I'm doing the grandma thing again. Beck, Alicia, Garrett, Alicia. Yeah. Yes, it's the same.
That's okay. My parents forget my name often. So they either call me my sister's name or my nephew's name. At least it's not the dog's name anymore, There's that. But what you're talking about is burnout, right? That's exhaustion, burnout, having to do too much, feeling like it's never enough. So who in here, since you've been working from home, works around the clock typically? Right? Trying to rein it in, difficult. The phones, yep. Electronic leash there. Vicarious trauma. Using trauma-informed or trauma-focused self-care community care. Healing in community. We do not heal alone a lot of times. We need community. We need that support. The adaptations made to survive, manage, and overcome traumas happen by pulling on strength and wisdom from who we are. Healing and resilience grows our full self into that process when my full intersecting roles, identities, and needs are welcome and safe. It's hard to do. It's hard not to mask. It's hard to show up. It's hard to be vulnerable. But that's what leads to resilience and healing. The impact of vicarious trauma. It's a natural response to witnessing the trauma of others. Personal traumas, survivorship, experiencing our own traumas, right? For some reason, I thought you were someone else, and I was like, whoa, now, consent. For those of you at home, Erin just kissed Rachel, and I was like, who's that kissing Rachel? For some reason, I thought you were wearing a different color earlier. Burnout and boundaries, right? I just asked who works around the clock. How can we not be burnt out? We are constantly on and having to respond to things and taking stuff in and being on screens. How do we get our nervous systems to relax? Besides listening to Jamie's Yoga Nidra or doing stuff like that, right? Yeah.
After my 2016 nervous breakdown, and notice I say the year because there have been many in my life, but after the 2016 breakdown, I seriously took my work email phone, and I've kept that commitment pretty solid since. Sometimes if I'm out there and it is like an emergency and I have to quickly, but then I take it off right away. And I have mostly kept Facebook off the phone too. And I only just do it when I'm on the laptop doing stuff. I wane on, I get a little lazy with that sometimes, but I would say taking work email off the phone has made all the difference in my ability to at least have some pillow of sanity.
Having a visceral reaction to that right now, knowing just how many emails, knowing how many emails I have to respond to. My literal arthritis in my thumb hate me because if I'm not on my computer, I'm on my phone trying to respond and catch up to the million emails. And as a neurodivergent person, it's like, if I'm not overwhelmed, let me get something done because I don't know when I'm not going to feel that way again. And where's the hyper focus mode? Come on. When I need, why does it need it? Why am I hyper focusing on these bath towels? Who gives a shit?
Okay, so as someone who has historically poor boundaries around doing way too much work and things like that, I made myself, when I first started working for ICM, come out of the office at 5 o'clock. I will leave the office at 5, and I work at home. So, and there's kittens and it's awesome. But the thing is that having historically poor boundaries and being aware of that is really, really important. I don't keep my email on my phone for that exact reason. I mean, and additionally, nothing we do, y'all, is life or death.
I told you.
Yes, you tell me that. I'm quoting Jamie right now. Y'all, nothing we do is life or death. That email can wait, especially if you're doing something else. It can wait. Somebody might be disappointed. You'll live with it. You will, because someone's always going to be disappointed. Someone's always going to be mad. I don't want that to be at myself, on myself, for something I could prevent it from. I mean, too bad. You're going to be mad at me for a little bit, but you'll get over it. I'll get over it. It'll be okay.
And when I say life or death, I definitely mean, like, with the exception being a suicidal client or, the long, slow death. Yeah. But when we're talking about the minutia of doing trainings and like the essence of this work that, brings us together, you know, people will be pissed, people will be inconvenienced. We do our best to attend to that, you know, as good customer service. Yet at the end of the day, somebody I didn't know well also took their own life over an insurance audit. I mean, there was a mountain of other mental health issues, to be sure, but she was a therapist on our field, dancing mindfulness facilitator. And that was the thing that sent her over the edge, was like all the shame and work associated with this insurance audit. So especially because of that, I'm like, we'll deal. We'll deal.
Sorry to hear that. Yeah, you're right. We are not heart surgeons last time I checked. But sometimes it feels like it, right? Metaphorically. Are you raising your hand? Okay.
I think like sort of adding up like the last like several slides, because you talked about like community, which I was raised in a very Christian environment. So when I hear community, I automatically think church, and I automatically think absolutely not. And so it's like this weird like association with that word. I recognize now community can be like this really healing thing, but it's hard because I was raised by a single mom after my dad died, who was very independent and who sort of taught us to be, she told me that my name meant ruler of men, which to her meant like of men, like the male species. And it wasn't until I was in college that someone was like, it means honorable ruler, like ruler of people. And I was like, oh no, my mom told me it meant rule over people with Y chromosomes and penises. Like that's what my mom taught me. And so I think like this idea of building community was so difficult, and asking for help was difficult. And it wasn't until this year, like I knew I had anxiety on a low level, but like professional performance-based anxiety. And so I remember I went to my doctor's office, and she asked earlier this year, she was like, how are you? And I just burst into tears, and I was like, I thought I was fine. And she was like, have you ever thought about like anxiety medication? I was like, you mean that thing my therapist has been talking to me about now for about a year and a half? And so I remember when I first started anxiety meds like 4 months ago, I was like, is this how people feel all the time? Like other people, they just feel like not like like tense. And I'm like, I just felt, I was like, wow, this is amazing. And so I think even like this idea of like burnout and boundaries and trauma, it's like, for me, it was being willing to accept help on all these different levels of like figuring out like community doesn't have to be really judgmental, like hyper Christian Confederate people, but I'm from North Carolina, but also like it can also mean like embracing these different types of help from, and my doctor's great. She was like, you know, you're the person I worry about because you're the person who's not going to tell me that they're not doing well unless like your body's literally on fire. And I think part of it was just like all of these different layers of like reframing and recognizing like, okay, what is one more medication if I actually feel better? And so now like if you try to take my Prozac away from me, I would fight you, because I'm just like, me and Prozac are not together. Intimate partner relationship.
Happy marriage there. Yeah. You had your hand? No, you're good. Thank you all. Recognizing vicarious resilience, the healing properties of this work. I love this term, vicarious. Healing trauma, compassionate care, taking care of yourself using coping skills. Self-care is so weaponized. It's like having a mental breakdown. Oh, did you take care of yourself though? It's gaslighting in that way sometimes, and it's really, really overwhelming. Is self-care, which means I'm drinking water. I'm taking care of my body. That's it. I'm done. I wash my face. I'm literally taking care of my body. So microdosing self-care, recognizing that it's an action, it's not a destination. It is something that you can infuse into which is not easy either. And that part can be weaponized sometimes.
I actually hate the phrase self-care. I use it because people know what it means and it registered, but in capitalist culture, it's become such an event-centric thing. I like nourishment, and your example of drinking the water is like, what are you doing as lifestyle practice to keep yourself nourished? And one of my spiritual teachers has us do these inventories regularly. What nourishes you, what depletes you, and be able to look at it that way. Thought.
Love that. I'm going to use that.
I also really like the idea of attunement with self. I work with a lot of parents, and so we're always talking about attunement with their babies, with their children, but teaching clients to find attunement with themselves and really pause and check in with their needs, knowing that that could always be something very different.
Yeah, I was just noticing we're all joking and like laughing and aligning on the same things because we're all overworkers and perfectionist. And it's just funny. I was making the connections like, of course we all are in this room, right? We've like climbed that EMDR hierarchy of like, what's the highest thing that I can get? And we're the, high achievers. And so I was just kind of noticing like, of course, everyone in this room is overworked and burnt out. And yeah, just some. That's why we get
I was just thinking, I was having a conversation with someone recently, and they kind of gave me this gift of thinking about that have intrinsic value to me, as opposed to activities that I've had to infuse value into in order to convince myself to keep doing them. Do you know what I'm saying? And so finding like drinking water, like something that holds value without me needing to label it, or like something that I can just in touch, or connecting instead of disconnecting, right? As opposed to, these ideas of needing to say, well, if I go here and I do this and I buy that and I sit in this position and that's good for me, or it's good for the community, and trying to like continuously convince myself not to rest, I think is something that I'm hoping to shift around.
Definitely. Thank you all. Got it in the chat. We talked a little bit about not viewing or fixing others, remembering you're having a natural reaction to stress, that we're not meant to sit at a desk 15 hours a day. We're not meant to be on our screens that much. But this is also a largely AFAB or female dominated field. And oftentimes there is this that I have to prove myself and I have to do more. And we're in a field that has endless needs, that the solutions need to be bigger. That's why we're all here doing EMDR, because we want bigger.
I was stretching. I'm so
Oh, you're not? Oh, that's okay. I really thought you were raising your hand this time. Okay. That's okay. Attend to your own physical and emotional health. Again, not in a weaponizing way, but just even a check it, not a minute, even like a second. Just let me check in. I had a colleague before that I worked with when I was at San Francisco Women Against Rape. And I was like, oh, here, do you want some fries or whatever I was eating? And she goes, and I was like, what just happened? She's like, no, I'm cool. And I was like, what just happened there? She's like, checked in with my body. And I was like, oh, dang. That's a good one. People do that? What? Right. We're not just a floating head up here. Yeah. Getting information and support. Again, as my therapist says, people aren't going to know you need support if you don't reach out or whatever. Much like vicarious trauma, we have vicarious as well. So experiencing racism and structural oppression makes us work harder under injurious conditions with fewer resources. Just because we can does not mean we should. Just because we can does not mean we should. There can be creative, joyous, innovative things that come from these struggles. We witness or learned of others who have overcome, healed, and practiced self or community love, ceremony, and pride. There's a healing impact from seeing the strength of community, using cultural wisdom, language, healing arts, and strengths from community to grow. I regularly visit my ancestors in my calm space. I regularly take my little self to the cabin that is my calm space and leave her there with her favorite toys and my guru and Audre Lorde and my mentor. And there's a little stream outside. And when I have to do something hard, I say, okay, little one, I'm going to put you over here. You'll be safe and you'll be okay. And I'm going to have to go deal with this hard thing and I'll be back to you. So that cultural wisdom doesn't stop when people leave this earth, when they transition. It's there and accessible to us in a lot of different ways, maybe not explicitly. We inherit genetic resilience. While we can be resilient, it's also important to point to the struggle, to acknowledge it. It's all the time. And in the same ways that we can recognize that those who've come before us have fought these battles, and we also get to partake in their resilience. One of my favorite things to say is we stand on the shoulders of giants. I mean, I feel that in my gut. There's a lot of giants that I have come across in my life, in person, in books, and otherwise. And I wouldn't be today if it wasn't for them. So I've taken that vicarious resilience, and I think it's important to name it because we talk about vicarious trauma a lot. But vicarious resilience, you rarely hear about that one. Cultural humility. So, when I was first in graduate school, we had a terrible cultural competency teacher who would literally read off and be like, Black people need this type of therapy. Asian people respond to this. And literally that was on the licensing exam. And I still to this day tell my associates, just so you know, the licensing exam and the law and ethics exam, it's not about how good of a therapist you are. It's about learning their rules and doing it the way that they tell you to do it. Taking skill, and it's a skill to fit in to this very messed up thing that is not effective. And then go do it the right way, which is like learning and unlearning, learning and unlearning. It's exhausting.
All right, you're all set. So when will you all be back?
So when we talk about cultural humility, gone out, I mean, some people still use it. Jamie, you know what I'm talking about. Cultural competence implies that there's an end, that at some point I will completely understand your culture. No, I will not. I will not be able to completely understand any one person's experience. I can have deep, deep empathy for that. Competence is minimal, yes. It is not the standard exactly. Competence is a starting point. Humility is let me educate myself, let me listen to you, let me hold space for you, and let me continue to do this very hard work. It's a commitment, a lifelong commitment. Self-evaluation and critique, redressing power imbalances, developing mutually beneficial and non-paternalistic partnerships with communities on behalf of individuals and defined populations. And it doesn't have to be church. You build your own community, have our family choice. And it's hard to develop that. It's not easy to find your people. It's not easy to call them in. Y'all is my people. To be flexible and humble enough to let go of the false sense of security that stereotyping brings. Sit in that discomfort. It's yucky, but it's important. To assess the cultural dimensions of the experience of each client. Say that I don't know when I truly don't know, and to search for and access resources that might enhance immeasurably the care of the client as well as their future clinical practice. What are some communication obstacles? We started out the day with this, talking about some of those blocking beliefs that come up in these conversations, right? Not seeing someone else's perspective, not having empathy, or, you know, in other words, putting yourself in that person's shoes. Not having done your own work on your privilege. That's a big part of what we're here talking about today. What does that work look like? It's not a linear process. I can't give you a workbook, just say here, figure it out. Although maybe there are workbooks that are helpful. It's an ongoing process. And growth happens when we make mistakes. Mistakes are opportunities to learn. When come up with difficult things. Otherwise, we're just going to stay in our comfort zone. Not speaking the same language style. As somebody with ADHD who grew up in a Punjabi household, literally, if you did not interrupt, you would never talk. You would never be heard. So interrupting is a normal thing for me. I was actually dating a white person who was like, "You're really interrupting me a lot." And I was like, "I really, you know, that's very much about white communication." She didn't like that, but bye. But yeah, you speak over each other. The conversation flows. Is not, I am going to speak and then I will stop. And then you are going to speak. And then, you know, that's, yes, this, this idea of professionalism, right? Which is the next point. Even this concept of professionalism, what does it really mean? It's capitalism, it's patriarchy, it's white supremacy. Showing up as your full self. As an intersectional feminist therapist, I do disclose at times things to my clients. For example, I had a client who got on meds as an adult, and I let her know, well, I take meds too. I take an antidepressant. And she told me, if it wasn't for you, I never would have gotten any help. I never would be as okay as I am today because you told me it's okay to take meds. I grew up in a house where I was told that is a bad thing and it's not okay. And she was crying and saying, I wish that that was not the house I grew up in, because my life would have been different if I knew that I could have gotten support for this earlier. She has chronic pain, ADHD. When it comes down to it, professionalism is a concept that is set out by who? That benefits who? Right? And so, of course, we have boundaries. Of course, it's important to know what's what and to be ethical at all times. But to fully show up as yourself. I tell my associates all the time, you being you is healing. You showing up at yourself as yourself is role modeling for your client that they can be themselves too. Keeping it real. I keep it real with them. Tell them, transparency, what I know, you can know. How does this fit into EMDR? EMDR therapy is already integrated and integrative. We steal from everybody, yes. EMDR therapy is integrated, and integrative therapy fosters an anti-oppressive approach. Yes, Francine Shapiro was absolutely a feminist therapist, without a doubt. Just the choice that she gives to clients, it's obvious. Whether or not she called herself one, she utilized those tenets. It's naturally integrated and inclusive. It incorporates treatment concepts from various Eastern, Western, and Indigenous therapies. And we highlight that as ICM. And that is such an important part of making it accessible for more folks of color. It's informed by a network of theories. It has the backing. And Dr. Shapiro knew that. She knew that nobody was going to take her seriously, and she got a lot of flack for it. So her thing was research, 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 because the systems that she had to navigate, being AFAB, being this person putting this out here, and doing trauma work. In actual practice, EMDR therapy may perhaps best be described as a client-centered, interactive, interactional, intrapsychic, cognitive, behavioral, body-oriented therapy. It's all the things. It's your full self showing up, full experience. Levi's and Siniego highlighted the importance of a therapy framework that integrates the sociocultural, political, and legal realities that clients face to understand how philosophical, contextual, experiential, and pragmatic considerations affect the client. The integrated framework fosters the ability for therapy to explore what is underneath the client's presenting problem and the impact of intersecting domains. EMDR therapy can integrate a range of complementary considerations and the negative beliefs that the client internalizes due to social oppression, which is conceptualized as an anti-oppression index. So, how does this relate to us? ICM and anti-oppression work. Why are we here today? Why are we carving out time during our retreat? Why are we not all laying on the floor doing yoga? Because this is super important stuff. Because this is at the foundation of trauma work. And I think we were having a side conversation earlier saying, if you're not doing anti-oppression work, it's really, you can't call yourself a trauma therapist. The trauma of oppression is palpable. It must be addressed. There is no other way. Historically, ICM has prioritized anti-oppression, has highlighted it. We expect our consultants and faculty to do their own work and to represent ICM through the lens and acknowledgement of all forms of oppression. Some questions. How does this go with the approach, with your approach to the work you do? Does it flow? Is it something that you've had to make changes around? How have you committed in the past to doing this anti-oppression work? What commitment can you make here today as an ICM team member to do your anti-oppression work? And how will you keep this conversation going? Let's see how much time. I'm going to ask you to kind of take some of this and think about it. Sit with it. Identify the ways in which you've done the work. Celebrate those ways. And look at what the next steps are. What is more work that I need to do? Where do I need to provide myself with some education? Where do I need to stretch past my comfort zone? This is continuous work. It's not a one and done. I tell my nephew, well, I don't tell him directly, but yeah, it's really hard when you know everything. At 14, it's like it's really hard to know everything. You have no room to learn anything new. The older you get, the more you realize you know zero. It's like I don't know a lot. And that humility is an important part of this process. Considerations with the standard protocol. Not one size fits all, which I think it's set up to allow it to be tailored to each person, to be flexible in that. We empower the client right from the beginning. We give them the tools, we show them how to use them, we encourage them to use them at home. We start out by, what are you doing already? Pointing out and highlighting some of the things that the clients are doing already to cope, to survive. Helping the client understand they are in control of the process. I love when this question comes up at training. Which memory do we start with? Whichever one your client wants to. Do we have to go to the worst memory first? Does your client want to do that? Right? And it's so interesting to me that so many therapists have a really hard time conceptualizing, I need to ask my client what they want. And this gives them the freedom. And for some people, it really opens the door to that. Slower pacing. Take your time. There's no rush. Trauma work is hard and it takes a while. It's not a one and done, as we know. It's not a quick fix. It's not a miracle kind of thing. It takes time. The only way out is through. Visibility. Inquiries regarding identity, racialized experiences, and oppression-based trauma. Are we asking our clients about this? Are we looking at cognitive oppression or oppressive negative cognitions? Are we thinking that, okay, I'm going to work on this I'm not good enough thing? And then you walk outside and it's like, oh, someone says something racist or homophobic. And it's like, there we are again, right? Talking about the fact that a lot of these are ongoing traumas. We're treating trauma while it's happening. And we can't necessarily shift completely the world, but we're shifting the way we think about ourselves and internalize things, which is empowering people and causing healing. Lots and lots of amazing healing. Psychoeducation and clarification regarding the EMDR process. Lots and lots of information. I probably explain EMDR like 4 times before I get to reprocessing. In different ways. Because I know I have to hear things over and over and over again. It took me several times of hearing it in different ways to get my spiel down about EMDR. How to talk about it, how to explain it, how to make it work so I can understand it. Therapists need knowledge of historical injustices and to have empathy regarding the impact of historical and current inequities for folks of color. So important. Not recognizing that is extremely detrimental. I can't tell you the horror stories I've heard about some therapeutic experiences for folks. And it's heartbreaking because people don't come back sometimes. And then they don't get the help they need. And then what is that impact on the world, on their life, on the folks around them? So, summary of recommendations. How to be trauma focused and anti-oppressive in your work, spending more time providing psychoeducation on the front end. This inherent distrust of systems needs to be addressed as well. Call it out. Say it, right? Psychology has not been a field that has looked out for me. Right? How many queer and trans folks have been traumatized, hospitalized, all kinds of stuff? How many people of color have received ECT, things like that, right? This is not a field that has been inclusive or anti-oppressive. It takes a lot of work to integrate that and to make sure that we're doing that. Therapist transparency regarding positionality and social location in therapy. We are all privileged to have higher education. Not everybody has access to that. Even if you struggled to do it, you got through it. First person in your family. And so you have that privilege. And therefore you can have that impact even more so. And recognizing that clients come in and they expect you to be the expert. I'm not the expert. You're the expert on your own experience. Okay? And yes, I have the privilege of having this education to tie into your experience to help support you in your healing process. Create a safer space for the client and building a trusting relationship with a therapist. If you have clients who build rapport very quickly, there's a reason why. They've had bad experiences with providers. I think most of us in this room could raise our hands and say, yes, therapeutic experience. I've had bad experience with a doctor. Spending more time to get the client used to how this method will impact the client's experience with EMDR. So thinking about abreaction, how does that look when you go home? I ask that a lot of times. Does your partner, roommate, kid, whoever the end of that sentence is, understand what you're about to go into? Do they understand that you're going to be triggered? That you might need some space? One of the most common ab reactions I see is people going home and fighting with their partner. Because their partner just became the saber-toothed tiger. And their partner didn't know, so they fought right back, not realizing, oh, dang, you're having an ab reaction. You're having a trauma response to me right now, right? You're in this intensity and your brain is doing this work. And so you're responding or reacting in a survival way. Providing follow-up at the end of session and afterward preparation for leaving includes sensitivity to external world and racialized reality. That's why I kind of like to teach people how to shield. Because as soon as we can work on this, and as soon as you walk outside, somebody says something, somebody gives you a look. And Rachel's in jail. So I was going to wrap up with just talking about how I cope. What are some of the things that I do to deal with this? Each of you. This is overwhelming and it adds to burnout and it adds to anger and it's frustrating and it's a lot. Just a list of some different ways to cope. Obviously, you all have lots and lots of lists. Just going to go around and get some input, but looking at and just say, what is one thing that you're taking with you today? What is one thing I can do for self or community care or support? And what is one to do based on what's discussed here? So what is the takeaway? Just rhetorical questions for you to ponder. Questions? Questions, thoughts? Got a couple resources on here. And this is not too bad on timing. First name. You're welcome. Weirdly.
That was awesome. Can you stop the recording? Folks, you could still stay on the Zoom. I love how I make thaws out of everything, but I don't want, so couple housekeeping things.